My name is Rex Hauser. I am a neurologist with Paradigm Health Systems. Neurology is a field that deals with diseases predominantly of the nervous system, but to some extent the muscles. Basically, you're involving the brain, the spinal cord, the peripheral nerves, the muscles. I chose neurology because it's one of the more cognitive or intellectual fields. It's all about the puzzle. Paradigm was started by the group of neurologists, and we basically started looking at where do we refer a lot of our patients, and where do we have difficulties getting patients in to different specialties. So one of the things we see very commonly is a lot of spine issues, neck and back issues, so it made sense to align ourselves with a spine surgeon. We have a lot of overlap with orthopedics, so we brought in an orthopedist. Pain is a very common specialty that we work with, so we aligned ourselves with pain. Podiatry may not sound on the surface like there's a lot of overlap with neurology, but there is. So we have all these specialties under one roof, and we're looking to grow. There's a lot of other areas that we'd like to bring in to complete the model, to be a self-sustained unit, so we don't have to refer outside of Paradigm, and we can continue with every disease process that we see can be evaluated and treated in a rapid fashion and a controlled fashion in a way we as the physicians see as most appropriate. Conceptually, we felt it would be the perfect model for patient care in today's environment. And we've gotten the feedback from the patients in that vein that they do see the difference. The difference is when a patient comes in, number one, because we as the physicians have control of the organization and we have set it up where we have autonomy and some leeway, I have more time to spend with my patients. Minimum 30 minutes for a patient to come in, sit down. I'm not against the clock. So there's a lot of personal attention, a lot of time to hear all of your complaints, not just your main complaint. Once we decide on a direction, there's no real delay. In a lot of other offices, you may see a month, 2 months before you can get in to see this physician or even get this test done, much less your final treatment plan. So that control and that availability of the other specialties allows us to go through the evaluation and treatment process with a rapidity. One of the things we've created at Paradigm is a very personal approach. Again, we have a lot of time to spend with our patients. The patients are very involved in the care, and we've tried to create at our offices and at our associated facilities like Sterling Surgical Center a very boutique type of environment. It's not the typical stale hospital type environment. It's a very warm, welcoming environment. And that's another aspect of Paradigm, is that we're very picky about who we bring in, all the way up from the nurses and clerical staff, all the way up to the physicians. You have to have a certain personality to be here, and you have to be very welcoming and warm to the patients. It's all about that patient's experience. It's all about them leaving here feeling that they got the best health care possible, and that they had a very warm, pleasurable experience all the way around. The response has been nothing but positive. It's a great feeling as a physician to have a patient come back to you and say, it was wonderful. And that's across the board what we're getting. They love it. It was wonderful. The food is wonderful. I mean, every detail at this hospital is geared towards patient satisfaction. You have the CEO of the hospital walking into a patient room. How was your experience? Was anything not up to par? Because if something is not up to par, it will be addressed immediately.